if there are 16 cases that we have confirmed, there are probably, or we suspect there are many more out there.
It starts with a fever, a runny nose, and coughing, but it isn't a cold. Alberta Health Services reporting a whooping cough outbreak in the province's South Zone Thursday. With 16 confirmed cases so far, 3 people have been hospitalized.
Dr. Eddie Lang is the head of emergency medicine in the Calgary zone. He isn't expecting a significant impact in Calgary hospitals.
We need to be vigilant, but it's actually probably unlikely to have an important impact. The reason being that the outbreak in South is already well controlled.
Whooping cough, otherwise known as pertussis, is a bacterial infection that causes severe and prolonged coughing that can last for weeks. While AHS and Lang recommend the pertussis vaccine, part of the problem lies in declining childhood immunization rates. Dr. Vivian Satorp is the medical officer of health for Alberta's South Zone.
In some communities, we had 86% of kids immunized 4 doses by 2 years of age for whooping cough in 2008. Now, 2021, the data shows that we're some communities 23%.
Though it can impact people of all ages, infants under the age of 1 are at the greatest risk of pertussis complications. They can include pneumonia, convulsions, brain damage, and even death. Lang believes the decline in vaccines could be a matter of pandemic disruptions.
Remember, we have had limited access to community clinics, primary care, family physicians, who were not always seeing kids during the pandemic period.
AHS has confirmed cases in Lethbridge, Coaldale, Tabor, Vauxhall, Grassy Lake, and Bow Island. In Calgary, Tate Laycraft, City News.